Assalamu alaikum. Hello my dear students. Hope you are doing good. I am Dr. Karim Rezwan Hasan, Associate Professor, Department of Anatomy, Women's Medical College. Welcome you back to the third part of bones presentation. In the previous classes, we have discussed about the definition of the bone, composition of the bone and the classification of the bone, specifically morphological classification. Today we will discuss some other classifications which are commonly asked in your professional exam. Not only that, one of the very important topic which is the blood supply of a long bone. Classification of the bones according to their positions. First of all, regarding the positions of the bone, some of the bones are present centrally, that means at your central axis of your body, and some other bones are present peripherally. The bones which are present centrally or at the central axis of your body, they are called the axial bones, like the vertebra, ribs, sternum, etc. Some of the bones are present peripherally. They are called the appendicular bones. The appendicular bones are the bones of your limbs, like humerus, tibia, fibula, femur, etc. Now another classification is present according to the source of development. In the source of development, the bones are commonly coming from the somatopleuric layer of lateral plate mesoderm. These kind of bones are forming the bones of our body wall, like the bones of our limbs and all the bones of our trunk. Another source is that visceral bones. Visceral bones are coming mainly from the bronchial arches and the periosteal mesoderms. These bones are mainly the bones of the face and neck and also the head. Mandible, hyoid bone, ear ossicles, skull bones, bones of the larynx and pharynx are coming from these sources. Now another classification can be present according to the developmental process. Some of the bones are having ossification, that is the intracartilaginous or endochondral ossification. The bones which are long bones commonly having this kind of ossification, and some other bones are having intramembranous ossification. We will discuss about this intracartilaginous and the intramembranous ossification in details in the coming days. Now, the most important topic of today's presentation is the artery supply and the venous drainage of a long bone. We know that in a growing bone or in a developing long bone, the parts are epiphysis, metaphysis, diaphysis and also the epiphyseal plate. Now, in between the epiphysis and the diaphysis, the epiphyseal plate is present, and close to the epiphyseal plate, the part of the diaphysis is called the metaphysis. Each and every part of this developing long bone are having their own blood supply. First, let's see what are the sources of the blood supply. Number one, nutrient artery, as we can see over here, then periosteal artery, epiphyseal artery and the metaphyseal artery. Very much obvious that all these arteries are named according to the area where they are supplying. Now let's see. Nutrient artery. Nutrient artery are the major arterial source of a developing long bone. These nutrient artery are mainly coming from the neighboring systemic arteries. This nutrient artery will enter into the long bone through the nutrient foramen. After entering into the nutrient foramen, it will reach up to the medullary cavity. Within the medullary cavity, this nutrient artery will be divided into two parts, ascending and the descending. The ascending and the descending arteries will send numerous small arteries to the inner two-thirds of the compact bone. Not only that, they will go above and down and give so many numerous smaller branches. Those branches will then reach up to the metaphysis and epiphysis and do some anastomosis with the epiphyseal and the metaphyseal arteries over there. So the main focus is nutrient artery is not only supplying the medullary cavity, but also it is supplying the inner two-thirds of the compact part of the shaft or the diaphysis, and ultimately they will do anastomosis with the metaphyseal artery and the epiphyseal arteries. Now, the periosteal arteries. In case of periosteal arteries, it is mainly coming from the neighboring muscular arteries. These periosteal arteries should be present in the periosteum. As far as we can remember, periosteum was having three layers: outer fibrous layer, middle vascular layer and inner cellular layer. So in the middle vascular layer, the smaller blood vessels which was present, that was the periosteal arteries or periosteal blood vessels. So obviously periosteum, as it covers the outer compact part of the long bone, it will definitely supply the outer part of a long bone. So we already know that the nutrient artery is supplying the inner 2/3 of the compact part, so the outer 1/3 will be supplied by the periosteal arteries. These will be very smaller arteries that is coming from the exterior, and the source of the periosteal arteries are the neighboring muscular arteries. Now the epiphyseal arteries. In case of epiphyseal arteries, these arteries are also coming from the arteries which are around the joint. Now around the joint there is always some anastomotic arteries, and those arteries are coming from the neighboring systemic arteries or they are coming from the muscular arteries. Now these epiphyseal arteries are entering into the epiphyses. Not only that, some of the arteries may pierce through the epiphyseal plate and they can do anastomosis with the metaphyseal arteries and the nutrient arteries. These epiphyseal arteries, when they are entering through the epiphyses, they are forming numerous vascular foramina, and that's why at the end of the long bones we can see so many smaller foramens. Those are called the vascular foramina. Lastly, the metaphyseal arteries. The metaphyseal arteries are also coming from the arteries which are present around the joint. They will also enter into the metaphyseal region of a developing long bone through the vascular foramina. Metaphyseal arteries are also do anastomosis with the nutrient artery and the epiphyseal arteries. In this picture, we can see the artery supply of developing long bone. We can see this is the nutrient artery and it is going through the nutrient foramen. After entering into the medullary cavity, it is divided into two branches, ascending branch and the descending branch. From the inside, it is giving branches that is supplying the inner 2/3 of the compact part. We can see that. And at the outer part, the arteries, smaller arteries, these are the periosteal arteries. Then the nutrient artery is entering into the metaphyseal zone and it is anastomosing with the metaphyseal arteries that is coming from the separate source. Not only that, these arteries, smaller minute arteries, they are crossing the epiphyseal plate over here and anastomosis with the epiphyseal arteries. None of the arteries will cross the articular cartilage, which is the extreme end of the growing long bone. Now, in case of developed bone, the arteries are mainly three: nutrient artery, periosteal artery, and the arterial arcade around the joint. We are having only nutrient artery and periosteal artery over here. There is no metaphyseal artery or epiphyseal arteries over here, because the so-called epiphyseal and the metaphyseal arteries are combinedly from the arterial arcade around the joint, as in the developed bone there is no epiphysis, metaphysis or diaphysis. Now the artery is giving supply as the same manner as the developing long bone. What about the venous drainage? In case of venous drainage, we can see that there is a central venous sinus at the middle of the medullary cavity. From the venous sinuses, actually all the smaller veins will drain into the nutrient vein, epiphyseal vein, metaphyseal vein and the periosteal vein. That means the veins are very much similar with the arteries. So for the better understanding of the total sequence of the artery supply, we can see a small video. Let's watch the video.
Before going into the blood supply, let's quickly review the anatomy of a long bone. A long bone is divided into three parts. The elongated tubular central part of the long bone is called the diaphysis. The enlarged area of the bone at the ends is called the epiphysis. The intermediate segment of the bone connecting the diaphysis and the epiphysis is called the metaphysis. The articular ends of the epiphysis or the joint surface are covered with articular cartilage. The rest of the external surface of the long bone is covered with a tough connective tissue sleeve called the periosteum. Nutrient foramen is an oblique canal usually situated in the middle third of the diaphysis of the long bones. Blood supply of the long bone accounts for 5 to 10% of the cardiac output. A typical long bone receives blood supply from various sources. These include nutrient arteries, epiphyseal arteries, metaphyseal arteries, and periosteal arteries. Let's look at them one by one. The nutrient arteries form a high-pressure system derived from major systemic arteries. It enters the long bone shaft or the diaphysis through the nutrient foramen. In the medullary cavity, it divides into ascending and descending branches which extend longitudinally along the axis of the long bone. These branches gives off a number of smaller lateral-oriented parallel vessels called the radial branches. These branches supplies the bone marrow and the inner third of the compact bone of the diaphysis. At the metaphysis, the ascending and descending vessels divide repeatedly into smaller spiral vessels which are joined by metaphyseal and epiphyseal arteries. Metaphyseal arteries arising from the anastomosis around the joint enters the metaphysis at the margin of the joint capsule attachment. These metaphyseal arteries anastomose freely with the spiral branches of the nutrient arteries, making the metaphysis most vascular area of the long bone. Epiphyseal arteries are derived from periarticular vascular arcades. The epiphysis has openings that permit passage of large number of vessels in and out. In children, the epiphyseal vessels are separated from the metaphyseal vessels due to presence of the epiphyseal plate. In adults, the metaphysis and the epiphysis are fused together following the arrest of the growth cartilage. Here, the epiphyseal arteries freely anastomose with metaphyseal and the nutrient arteries. When articular cartilage and the epiphyseal cartilage are continuous, the epiphyseal arteries pierce the epiphyseal cartilage and supplies the epiphysis. If these arteries are damaged in epiphyseal separation, a vascular necrosis of the epiphysis may occur. In other bones where the articular cartilage is not continuous with the epiphyseal cartilage, the epiphyseal arteries enters the epiphysis without piercing the growth plate. In these cases, epiphyseal separation will not cause a vascular necrosis. The periosteum has a rich blood supply from the blood vessels which anastomose beneath the periosteum. Periosteal arteries act as a low-pressure system and penetrate bone at the sites of attachment of the facial sheath or aponeurosis. They enter the Volkmann's canal and supply roughly the outer one-third of the compact bone of the diaphysis. Long bones drain into central venous sinus. From central venous sinus through nutrient vein, periosteal veins, and emissary veins, it drains out.
So my dear students, we already seen the video. In the video, it was very much clear like the nutrient artery, periosteal artery, metaphyseal and epiphyseal arteries are very finely supplying the developing long bone. Not only that, we also have a clear idea about the venous drainage of a long bone. So that was the total discussion of today. In the coming class, we will discuss about the ossification. As we have already told you, what is the ossification? That is the process of formation of bone. There are two types of ossification: intramembranous ossification and intracartilaginous ossification. Till then, stay safe.